It's you. So I'm Karen. I'll be the nurse practitioner
Nice to meet you.
taking care of you today. Who do I have the pleasure of seeing?
My name's Tony.
Okay. Can you confirm your full name and birthday for me?
Yep, my name is Tony Niemeyer, and my birthday is July 24th, 1963.
Okay, great. And what is bringing you into the clinic today?
I've been having some increased swelling in my leg. It's been getting red. I almost feel like it's getting warm a little bit.
Okay.
Not sure, but there's pressure. It seems like it's getting worse. It's been going on for a while. I thought it would get better on its own by now, but it's not.
Okay.
So it's kind of making me worried.
Okay, yeah, we'll definitely address that today in this visit.
Okay.
First, we're just going to get to know you a little bit, if that's okay.
Mm-hmm.
So are you working retired or?
Retired.
Retired,
Yeah, I just
okay.
retired a couple months ago in September.
Okay, and what did you do before you were retired?
I was a physical therapist.
Okay, awesome.
Yeah.
Well, very cool.
Good. It was good.
Good. I'm glad you enjoyed it.
Yeah.
And then are you married, single, in a relationship?
Married.
Okay.
Yeah. So my wife is also retired. So.
Okay, very cool. How long have you been married for?
Oh boy, yeah, 39 years.
Nice. Well, yeah. Congrats.
Yeah.
Do you have any kids?
4.
4. Okay. Any grandkids?
2.
2.
Yeah.
Very cool. Well, that's exciting time in your life. It sounds like.
Yes,
very cool.
Is.
Okay. And then socially, do you drink at all?
Rarely, I would say. Yeah.
Okay.
Yeah.
Okay. Do you smoke cigarettes or?
Not.
Okay. No
Never
vaping
have.
or any other type of smoking?
No. Never. Yeah.
Okay. All right. And then any drug use other than prescription medications?
No.
Okay. What do you like to do for fun now that you're retired too?
I like hunting and fishing, mostly all outdoor activities. Like to go hiking and skiing, whatever in the sea is in the season. That's what, I like to do outdoor things.
Okay,
yeah.
Very cool. So you do those things to stay active. Do you have a regular exercise routine?
Since I retired, I've been trying to utilize our YMCA membership a little bit more.
Okay.
Yeah, we've always had a family one, but wasn't good about using it. But now I'm trying to pick that up.
Okay. How many days a week would you say you try to go?
I would say that I try to go 5 days a week.
Okay.
Many weeks it happens to only be 2 or 3.
Okay. That's a good goal to meet, though, for sure.
Yeah.
Okay. Moving on into a little more medical history. Are you diagnosed with any medical conditions?
I was diagnosed with asthma as a child, and then prior to being a physical therapist, I worked at Beulah, the coal gasification plant. There's a lot of chemicals there in the environment, and I was then diagnosed with occupational asthma. And then I did end up leaving that job because of respiratory issues. Otherwise, not really any significant medical history. I do have just a little bit of high blood pressure, so I take a low dose of lisinopril.
Okay. So you take lisinopril. Do you know the dosage at all for it?
10 milligrams.
Okay. Once a day?
Once a day in the morning.
Okay.
I always take it, yeah.
Okay. And then do you take any other medications or anything for your asthma?
I do have an albuterol inhaler that's prescribed to me from a different doctor that he wants me only to take for emergencies, but I take a couple of puffs every morning.
Okay.
It just seems to open me up.
Okay. And no other medications, right?
No.
Okay. All right. And then any surgeries at all?
The 2 surgeries that I've had is I had a reconstruction of my ACL ligament in my left knee, and that's been 30-ish years ago.
Okay.
And then I had a nasal reconstruction. I was always getting sinus infections probably once a month, and that was probably 25 years ago. I had the Roto-Rooter surgery.
Okay,
Yeah.
sounds good.
And it was very successful for me, so it's
Okay,
helped a lot.
all right. And any significant family history for medical history?
Okay, my dad died of cancer.
Okay,
Yep. And my mom is still living.
okay,
She is medically very healthy. So
okay. What type of cancer did your dad have?
he died of lung cancer.
Lung cancer. I'm
Yeah.
sorry about that.
Yeah, thank you.
Okay. All right. And then your grandma's or your mom's side, you said was healthy. Didn't have any medical
Right,
concerns on that side.
right.
Okay.
Yep. So they have good hearts. My dad's family also has his brothers and sisters have had heart issues. So
Okay.
as far as I can tell, I didn't inherit that from my dad's side.
Okay. Okay. All right. So moving on to more of a reason why you're here, just
Yeah.
having you tell me a little bit more about that. So you said it's been going on for how long?
I'm gonna say that it's been at least 3 weeks.
3 weeks. Okay.
Yeah.
And when it's located on your left lower calf there, have you seen that it's expanded or that it's changed at all since it originally showed up?
I think that it's gotten bigger, a little bit more swollen, and I'm gonna say more achy.
Okay.
Yeah.
Okay. And it's been constant for the last 3 weeks, or did the swelling go away and come back?
It's been constant, maybe just steady getting a little worse.
Okay. And you said it felt like an aching feeling.
Yeah.
Would you describe it any other way?
Pressure.
A pressure
Maybe
in
I'd
there?
say the word pressure. Feels, sometimes I've been feeling it. Feels a little hot. I
Okay.
think when I compare it to the side, I feel like it's warmer, but yeah. And then it makes it a little harder to walk.
Okay.
Trying to be active and going.
Okay.
Yeah.
All right. So you said that walking makes the pain worse, I'm assuming, is what you're talking about, harder.
Yeah.
Anything else make these symptoms worse?
Just being on it.
Okay.
Yeah.
And then anything make it better?
When it gets sore during the day, I just sit down and put the feet up on my lazy boy chair. That's just to make it feel better.
Okay.
As good as it can. It still bothers me, but that's what I do to try to get some relief.
Okay. Do you see any difference in time of day that these symptoms come and go?
Maybe I would say that it's a little better in the morning and worse at night after I've been up on it all day.
Okay. Okay. And on a scale of 0 to 10, what would you rate your pain? 0 being no pain at all, 10 being the worst pain.
Well, so it does vary some during the day, but I'm going to say on average 6.
Okay. Would you say that's what you're currently at is about a 6?
About, yes.
Okay. And then how would you say this is affecting your day-to-day life?
That I can't be as busy during the day getting stuff done that I want. I have to sit down more often and put it up and rest.
Okay. All right. Yeah. Like we said, we'll hopefully get this taken care of today or get something for you to take care of it. So moving on to kind of some other body systems that I'm going to ask some questions about. So have you had any fevers or chills in the last couple of weeks?
Not that I know of for sure. I haven't taken my temperature, but yeah, sometimes I feel like it's a little bit the chills. I'm not sure if it's because it's getting colder out, but
okay. And any increased fatigue at all?
Not too much.
No.
Not that I can tell.
Any shortness of breath or chest pain?
No.
Okay, well that's good.
Yeah.
And any swelling in like both legs, ankles, or feet?
No, this leg has been
totally fine.
normal.
Okay.
Yeah.
Okay.
Yeah,
And
just swelling out. So.
You've never had any swelling in legs, ankles, or feet?
No.
Okay. Any recent travel at all?
No.
Okay. All right. That kind of concludes those body systems since this is very kind of localized to this area. I am going to check out your leg here. So I'm just going to take off your sock and we'll do just a little exam on this leg.
Okay.
So I can see that you have kind of some spots. Do you know where you got those kind of skin breakdown spots from?
Well, I was cutting some trees.
Okay.
And, just those sticks are all over and trying to load them on a trailer to haul them out to the dump ground and, scraped my legs quite a lot. I can't say exactly when, but I'm sure it happened during the couple days when I was cutting trees.
Okay. Okay. All right. And then I can see you do have some swelling area. I would say I can kind of measure with my palm. It looks like between those two spots, maybe a 3-inch section with an inch on each side that I can see that swelling. Mm-hmm. And it looks like it is blanchable, which is good. There's not a regular border around it. It just, the swelling kind of just slides right into your normal skin, which is what we normally see with cellulitis.
Does that mean it's infected? Do I have an infection?
It kind of looks like that right now. We always kind of have a main diagnosis, and then we have to think and rule out some of the other diagnosis that we consider. So some other assessment findings that I see on your legs is that you do have hair on your legs. It doesn't seem like it's evenly distributed. You have kind of on this lateral side, there's no hair on that legs. And then you said there's a few varicose veins there that I can see. Are those new things or are those old?
No, I've had these varicose veins for quite a while.
Okay.
I know, and then my family does have those. I know my dad did and my sister does.
Okay. And then the hair loss,
Yeah. Well, I used to have real hairy legs.
But that's been long term, or has that been going on?
It seems like it's getting less and less as I get older.
Okay. All right. Your pulses are 3+, so I can easily palpate those pulses. When I touch your foot, can you feel that? Mm-hmm. Okay. Any numbness, tingling, or does it feel like a dull sensation? Okay. Any pain at all when I touch this area that's red?
Kinda.
Okay. Yeah. And it does feel warm to the touch too. So like we said, I am concerned that you have cellulitis on this leg. Some of those other differential diagnoses is that another thing when you have pain and swelling in your leg is that you could have DVT, so a deep vein thrombosis. However, you don't have any of the risk factors. You haven't had long travel in the last couple weeks, which is a big risk factor. And you're up and active. You're not kind of sedentary. You don't have AFib that would make you more at risk for blood clots. So it's not really something I'm concerned about. And then I'm also not concerned that this infection is going any deeper or that it's complicated. So what we say is it's an uncomplicated cellulitis. You're kind of feeling that infection where you might have chills, but you haven't actually kind of spiked a fever or took your temperature or really taken Tylenol for it. Yeah. It's not kind of going into your knee, so I'm not concerned about your joint even with that surgery. So it's a pretty simple fix. What I'll do for you is that I'm just going to prescribe you oral antibiotic. I want you to take it all the way through till it's finished. So we'll give you an antibiotic called Keflex. That's kind of our first line for a cellulitis like this. I'm not concerned about MRSA, that really bad infection, because there's no boils or abscesses on this leg either. But that Keflex or cephalexin is kind of the generic name for it. We'll give you a prescription of that. Take it all the way through. It's a little easier on your stomach if you do take it with some food. And then I'll see you when that prescription's finished, just to make sure that this is healing up.
How long is that?
I'll have to look at the prescription. Usually it's like 7 to 10 days. So we'll see what the best fit is for you. And I'll send it to your pharmacy, and then we'll have it all in your discharge paperwork as well.
Okay.
So other things that you should know about is just when to come back. So other than our follow-up, I want you to come back if this starts getting worse. If when you're on the antibiotics, if it's spreading up your leg at all, or getting worse, not better, you should start to see it get better in like 2 to 3 days. So if you start to develop those fevers, chills, even like nausea or vomiting, that's a concern that this infection is getting worse, and it probably needs more than just oral antibiotics.
Okay.
Okay. Do you have any questions for me at all?
Should I put ice on it or anything, or continue to elevate it?
You can kind of continue to elevate it. I don't know if ice is necessarily necessary, but if it feels okay, that's fine. We just want you to keep those areas clean. It's essentially the antibiotic will do the job there, but if you have other symptom management things that are non-pharmacological that work, you can continue doing those. I don't think it would necessarily hurt.
Okay.
Okay?
That sounds good.
Any other questions?
No.
Okay. All right. Well, it was nice meeting you.
Nice to meet you.
Yeah.